Hello, here is my summary for my preceptorship. I did my preceptorship at the Unit 31, which is the renal unit at Red Deer Regional Hospital. And I'd like to introduce you to this guy on the screen who is Kim Lee, named after our nephrologists, Dr. Jim and Dr. Lee. He's the unit mascot and he's a kidney. Anyway, so we have 23 rooms on the unit with 36 patient beds. There are also 3 OCP rooms, which are basically a tub room and the patient's TV lounge curtained off into 2, which we seem to use all the time because we are always on over capacity. Some of the rooms are private rooms or isolation rooms. These are for patients who are positive for C. diff or questioning whether they are, or methicillin-resistant Staphylococcus aureus, or tuberculosis, just to name some of them. We've even had to isolate a couple of patients because of head lice, and they're going to stay there until they're all cleared up. So, being a renal unit, the majority of the illnesses that we are dealing with are to do with chronic kidney disease and some of the illnesses that lead up to that. For example, diabetes. Diabetes can lead to chronic kidney disease, as can heart disease and congestive heart failure. High blood pressure can also be a cause of kidney disease and the reverse is also true, because the kidneys produce a hormone that helps control the blood pressure. If the kidneys aren't working as they should, then that can lead to high blood pressure. We also have the patients that are in complete renal failure, and these patients are going to be having dialysis. I've seen 2 types of dialysis. There is the peritoneal dialysis, where a permanent catheter is inserted into the abdomen so that dialysis fluid can be inserted to clean the blood. And then there's the patients that go for the hemodialysis, and they go down, some go down every day, but it's usually every other day. And then they are attached to a machine that pumps their blood to remove excess fluid and waste through the machine. The access for the hemodialysis is through a large vein, which can be a fistula or a graft, and it is surgically placed. We are doing lots of standard tests on our unit, which are the main ones are the echocardiogram, electrocardiogram, colonoscopies, and gastroscopies from the some of the endoscopic procedures that we're getting done. We have lots of patients that go down to get PICC catheter insertion, and we are routinely doing lots of ultrasounds and CTs and chest x-rays and the likes. The routine blood tests that we do are mainly to do with renal function. So we're doing lots of urea, creatinine, potassium, electrolytes, CBC, albumin, calcium. These are all checking, as I say, for any dysfunction in the kidneys. And then we also do lots of glucose tolerance tests for the diabetic patients, and also lots of urinalysis where they're looking for blood and protein in the urine, because these are also useful for detecting kidney damage. Some of the standard medications that we are using there would be insulin, blood thinners, blood pressure medicines, antibiotics, analgesics, lots of bowel medications and bowel procedures being ordered. We are seeing the nephrologists every day on the unit. As I say, Dr. Jim and Dr. Lee are the nephrologists. We also see lots of hospitalists, residents, gastrointestinal doctors are on the unit a lot because there's lots of issues with that. And also a lot of family doctors with hospital privileges that are in to see their patients. We are seeing lots of occupational therapy, physical therapy. We see the ACE team, the acute care for the elderly, the social workers, the clinical nutritionist. So many of these other interdisciplinary teams are on the unit daily. The PTs are especially helping the amputee patients to get ambulated as best they can before they are able to go home. The amputation can be one of the conditions that has happened because of their kidney damage or their diabetes. There are 4 nursing teams working on any shift, and they consist of 1 registered nurse, 1 licensed practical nurse, and 1 healthcare aide. There's usually always a charge nurse on. I found that the weekends it's always the registered nurse on the A side who will be charge nurse for those shifts. There's usually a couple of floats going about helping where they're needed. And there's the unit assistant who is filling up the nurses' carts with anything that they might need and filling up all the cupboards, keeping them all well stocked. She does an awesome job. The biggest challenge I found was getting to know who is a nurse versus an LPN, or who is a doctor versus a patient. That got better towards the end. I found it extremely helpful if the doctor was wearing a white coat, because that kind of made them stand out, but they don't always. And with time you get to know the therapists and the other teams. I found that my strength is my ability to interact well with everyone and having the confidence to tackle anything and everything that comes my way. I might not be able to do it perfectly by myself, but I certainly will try. My weakness was that I am slower than I need to be, but I know that's going to come with time. And I did have one day where my regular preceptor was sick, and I got a little frustrated when this stand-in preceptor did not do things the way I had been shown. But I've just got to realise that not everybody's going to do everything the same way, and that's fine. And I'm just going to do it the way I've been shown and make the best of that. All in all, it's been a wonderful experience. I've absolutely loved my time on the unit, and it's just consolidated in me the desire that this is what I want to do. And I'm happy to share with you guys now that Shannon, the unit manager on 31, has offered me a casual position, and I will be starting just as soon as my paperwork's done. I hope everyone else has enjoyed it as much as I have, and I hope to see you all soon. Bye for now.